This 30-minute webinar was created by the Wisconsin Newborn Screening Program to provide a quick guide for completing information requested on the newborn screening card. Funding for this project was provided by HRSA under the grant of Improving Timeliness of Newborn Screening. Its contents are solely the responsibility of the authors and does not represent endorsement by HRSA, HHS, or the U.S. government. The Wisconsin Newborn Screening Program, together with our healthcare partners across the state, work together to ensure that all newborns have been provided the opportunity to be screened for congenital disorders where early intervention provides the best outcomes. The newborn screen includes testing for hearing loss, congenital heart defects, and more than 40 different disorders on the Wisconsin panel that can be identified within the dried blood spot. Whether a birth occurs in a hospital setting or within the community, it is the responsibility of the healthcare provider to initiate these screens. All health providers, including nurses, phlebotomists, midwives, and birth attendants, may participate in the process of completing the required information on the card, performing the hearing and heart screening, collecting blood, and sending the specimens to the newborn screening laboratory. The newborn screen is a baby's first test, and a newborn screening card must be completed for every baby born in Wisconsin. If parents decline screening, timely completion of the demographic information and delivery of the card to the newborn screening laboratory is still required. The information requested on the newborn screening card is used to identify the baby, collect demographic information necessary for interpretation of test results, provide necessary contact information for reporting of critical results, reporting issues of hearing and heart screening, and create a baby's permanent health record. Missing or incorrect information provided on the cards costs healthcare providers and the newborn screening laboratory time, but more importantly, may prevent accurate interpretation and delayed notification of test results. Therefore, it is our shared responsibility to ensure that all fields on the newborn screening card are complete, legible, and accurate. Currently, there is not a standardized or universal label used across all facilities that captures key identifiers for the baby. The requested card information is filled in by hand. As a reminder, use of a medium ballpoint pen with black ink works best to ensure that the writing is transferred through the multiple sheets of the card.
In Section 1 of the webinar, we will review how to complete the fields labeled as baby's name, multiple births, sex, baby's ID, and mother's name. But first, please consider the importance of providing legible handwriting. In the fictitious example below, you can see a completed field with a baby's name of Wade Trenton Henry. Can you help us decipher what is the correct name of the baby? Henry Wald Trenton? Henry Wade Trenton? Trenton Henry Wald? Trenton Henry Wade? This is a common situation in which the person completing the card uses both upper and lowercase letters for the written name. In addition, there is no hyphen or commas to separate the first from the last and middle names. It would be difficult for the data entry staff in the laboratory to correctly key the baby's name without first calling the submitter for clarification. Phone calls cost time. This may delay notification of important screening results to healthcare providers. Newborn screening site liaisons can play an essential role in helping to resolve missing, inconsistent, or unclear information in a timely manner. Here are some quick reminders for when you are completing these 5 fields: baby's name, multiple births, sex, baby's ID, and mother's name. For the baby's name, write the last name before the first name. Use only uppercase letters. Never use cursive handwriting. Use commas to separate the last and first name. Hyphens between 2 last names can be added to help with clarification. Within the newborn screening laboratory information system, hyphens between multiple last names are necessary. Therefore, please allow this as an acceptable alias on patient reports. Using these tips, the baby's name from our example should have been written as Wald-Trenton, Henry, to help eliminate confusion. When completing the multiple births field, confirm whether the patient is a multiple at birth. If twins, the baby born first is denoted as 1 of 2. The baby born second is 2 of 2. Please note that this field reflects the current birth. It is not a marker of the number of pregnancies the mother has had. For the field requesting baby's sex, we are asking about the physical attributes of the baby, not the parent's preferred gender of their baby. Please always circle either M for male or F for female. In rare cases, when the external sex organs are not developed and sex cannot be determined, please state unknown on the card. The field labeled baby's ID number most often is used to record the baby's medical record number. This number confirms identity of the baby when communicating with healthcare facilities. Please be consistent in the use of this field. At times we have seen a mix of medical record numbers and lab accession numbers or billing identifiers in this box. If your process requires more than one unique alphanumeric identifier in this field, keep the order in which they are listed consistent. Many ID numbers have both letters and numbers. Please be careful with 5s and S's, as they can look very similar. Mother's name at the time of delivery is a primary identifier used to confirm the identity of the baby. When completing the mother's name, please use the same tips previously stated for baby's name. Write the last name before the first name, use only uppercase letters, never use cursive handwriting. Use commas to separate the last from the first name. Add a hyphen between 2 last names. And if the name provided is not the birth mother, please make a note of it on the card. For other unique situations, such as surrogate mothers or adoption, please call the laboratory for clarification. On this slide, you can review the details provided for each field. When you are ready to begin the next section, click on the Next button.
Let's move on to the completion of 6 fields that have been deemed key information. These are the baby's date of birth, time of birth, date of specimen collection, time of specimen collection, birth weight, and gestational age. All 6 fields are used to modify cutoffs for a given test. These 6 fields are also highlighted on the monthly quality assurance report. To stress the importance of accuracy, consider the example below. The newborn screening laboratory performs testing for congenital adrenal hyperplasia using the analyte 17-hydroxyprogesterone as a marker for the disease. The measured laboratory value for 17-hydroxyprogesterone in the baby's sample was 105 nanograms per milliliter. To determine whether the baby is at risk for congenital adrenal hyperplasia, the laboratory must review the baby's birth weight written on the newborn screening card. On the newborn screening card, you can see that the weight at birth is written as 915. Is this 9 pounds 15 ounces or 915 grams? If the baby's birth weight is 915 grams, the cutoff for the normal result is 125 nanograms per milliliter, and therefore the value of 105 nanograms per milliliter is within the normal range. However, if the birth weight is 9 pounds 15 ounces, equivalent to 4,508 grams, the cutoff is 32 nanograms per milliliter, and the result of 105 nanograms per milliliter is marked elevated. This baby would be at high risk for congenital adrenal hyperplasia. It is imperative that the fields written on the card are complete, legible, and accurate. When these key fields are missing, illegible, or inaccurate, the newborn screening laboratory must call the submitter for clarification before data can be interpreted and released. This phone call, needed for clarification of demographic information, delays the notification of abnormal results to primary care providers. This can compromise patient care. Here are some important reminders when completing these fields. For the baby's birth date and specimen collection date and time, Write the dates in a 2-digit format denoting the month, day, and year. Record times using military time. Accurate date and time of birth and collection are needed to calculate the patient's age at collection. Please always double-check the provided dates and times, as errors are common in these fields. The birth weight is the baby's weight at birth, not the current weight of the baby, nor the weight of the baby at admission. This needs to be written in grams. Please do not submit birth weight in pounds and ounces. Please see our website for a reference guide on military time and converting pounds to ounces to grams. The gestation age is the number of weeks into the pregnancy that the baby was born. This number stays constant and should not change after the baby is born. When providing the gestational age at birth in weeks, record as a whole number. Round up if the baby was born 4 or more days beyond a full week. For example, if a baby was born at 38 weeks and 4 days, the gestation age is 39 weeks. In situations where there is no prenatal care, provide the estimated weeks. If no estimate can be made, record term or preterm or no prenatal care. On this slide, you can review the details provided for each field. When you are ready to begin the next section, click on the Next button.
In this section, we will review how to complete information on the baby's primary care provider and ordering physician, including the reasons why the requested information, such as NPI number, clinic name, city, and phone number, are important. In the following example, the primary caregiver is listed as Dr. Patel, with no first name. The NPI number is not filled out, nor is the clinic name, city, or phone number completed. When the laboratory receives a newborn screening card with a provider name, it is our practice to perform a search within our database to pull up the correct mailing address and phone number. The search under Dr. Patel lists approximately 20 providers with this last name. Can you guess which doctor is the primary care provider for this baby? The newborn screening laboratory must call the submitter to determine who is the primary care provider for the baby. This additional phone call and time required to correctly identify the provider causes significant delays in the notification of abnormal results. This compromises patient care. These requested fields on the card is the laboratory's only mechanism for finding the correct provider caring for the baby. It is imperative that this field is complete, legible, and accurate. Here are some items to consider when completing the fields labeled as baby's primary care provider, their NPI number, and ordering physician and their NPI number. The baby's primary care provider is intended to be the person who will be caring for the baby upon discharge from the birthing facility. If the newborn screen is abnormal, the listed primary care provider will be notified of the test results. This provider will also receive a copy of the newborn screening report. Always provide both the first and last name of the provider. As in the previous example, the NPI number can help ensure the correct provider is notified, especially when providers have similar names. For babies who will undergo an extended stay within the special care nurseries or the neonatal intensive care units, or NICU, it is acceptable to provide the name of the attending physician or the neonatologist as the primary care provider. The PCP's clinic name, city, and phone number is also requested. At times, a mother may not know which doctor will be caring for her baby, but will be able to identify a clinic to which they will go for care. Please provide the name of this clinic. The newborn screening card serves as the requisition for ordering the screen, and laboratory regulations require an ordering physician to be listed on the requisition, or provided within 30 days. The ordering physician data field captures the identity of the provider ordering the screen. At times, when no primary care provider is listed on the card, the ordering provider serves as a primary contact for conveying abnormal results. In some cases, the ordering physician and primary care provider may be the same person. A final double check is needed to confirm that the provider and ordering physician information is correctly written on the card and is consistent with the patient's medical record. On this slide, you can review the details provided for each field. When you're ready to begin the next section, click on the Next button.
The next section discusses requested information, which helps the laboratory identify babies that need extra interventions, such as transfusions or dietary supplementation, or babies requiring repeat screening. The highlighted fields in this section are baby in the ICU, repeat specimen, transfusions, and baby on TPN now. To illustrate the importance of completing the transfusion field, consider this example. A baby specimen collected at 48 hours of life shows a hemoglobin pattern of adult, fetal, and sickle, with the largest abundance of adult hemoglobin. This is unusual for two reasons. First is the presence of sickle hemoglobin, and second is a large abundance of adult hemoglobin. Typically, babies at birth will have more fetal than adult hemoglobin unless they have received a blood transfusion. In reviewing the transfusion field on the card, nothing was circled. What is the most likely cause of this inconsistent result? How should the newborn screening laboratory interpret these results? It is likely that the person completing the information on the card forgot to circle Y for transfusion. The newborn screening laboratory would call the birthing facility to confirm whether or not the baby received a transfusion. If this baby did receive a transfusion, then the presence of adult hemoglobin may be from the donor, and the baby may be at risk for sickle cell disease. If the baby did not receive a transfusion, then the baby is likely only a carrier for sickle cell disease. Again, it is critically important to fill in each field completely, legibly, and accurately to prevent a misinterpretation of laboratory results. Here are some reminders for each of the fields. For baby in the ICU field, please circle Y for yes if the baby is in the intensive care unit. If the collection is occurring just prior to discharge from the ICU, then circle N for no. The baby is no longer in the care of the ICU. If ICU is circled and the baby has abnormal screening results, we will call the ICU first as opposed to the primary care physician. The repeat specimen field is used to link repeat specimens back to the initial specimen. By circling Y, this informs the laboratory that additional previous specimens have been collected. An accurate result interpretation for current specimens may depend upon the result of previously collected specimens. If a baby received a blood transfusion prior to collection of the specimen, circle Y for yes. It is our practice to consider any blood product as a transfusion, even if just platelets. Provide the date of the most recent transfusion, as this is an important factor for determining whether the test results are valid. If the infant was transfused in utero, circle Y and record prior to birth if exact date is unknown. Please remember to keep circling Y for all subsequent screens after transfusion. For baby on TPN now, circle Y for yes if the baby is currently receiving total parenteral nutrition TPN or any other formulas that are supplemented with extra amino acids. A minimum of 4 hours after discontinuing TPN is needed before TPN now field can be circled as no. Elevated amino acids due to TPN can mask a disease state, and therefore it is important to alert the laboratory to babies who are receiving the supplementation. On this slide, you can review the details provided for each field. When you are ready to begin the next section, click on the Next button.
In Section 5, we will cover the following fields on the card: baby's race, Hispanic, birth facility, and mother's Hep B surface antigen. Some helpful reminders for these two fields, baby's race and Hispanic, are to circle all races that apply when a baby is of mixed race. For babies of Hispanic ethnicity, please be sure to circle Hispanic Y for yes, and also indicate the appropriate race. If a baby is part of the plain community, please indicate so by writing in the upper left-hand corner of the card, either Amish or Mennonite. If there's a family history of a known disease, you may also indicate this in the upper left-hand corner. In the birth facility field, please write the birth facility name. This is the place where the baby was born, which may be different from the facility or submitter who is collecting the newborn screening. Having a record of the birth facility is helpful when retrieving newborn screening reports and confirming the identity of a baby. If a baby was born at home, record home birth, along with the city and state. If the baby was born outside of Wisconsin, provide the name of the hospital plus the city and state, or country. If you do not know how to complete this field, contact Newborn Screening. A mother's hepatitis screening results are requested on the newborn screening card. Circle NEG for negative if the mother's hepatitis B surface antigen test result is non-reactive or negative. Circle POS for positive if the mother's hepatitis B surface antigen test result is reactive or positive. This information assures that the newborn of a hepatitis B antigen positive mother receives proper immunizations. Be careful not to confuse hepatitis surface antigen results with hepatitis antibody results, or strep B results. On this slide, you can review the details provided for each field. When you're ready to begin the next section, click on the Next button.
In the next section, we will discuss the blood not screened field. To ensure that all babies were provided the opportunity to be screened, the healthcare provider must complete a screening card for every baby, even if the testing will not be performed. To highlight the importance of the blood not screened field, consider this example. The newborn screening laboratory received a screening card from a small rural hospital within a few days after birth of the baby. The box for blood not screened transferred was checked, providing information that the baby born was transferred to a larger medical facility shortly after birth, possibly due to medical complications. 1 week later, the newborn screening laboratory has still not received a completed newborn screen on this baby from the medical center to which the baby was transferred. The newborn screening laboratory initiates a follow-up plan by calling the rural hospital to confirm the location to which the baby was transferred. The newborn screening laboratory calls the receiving hospital to see if the baby has been admitted and whether the newborn screen was ordered. In this case, collection of the newborn screen by the receiving hospital was overlooked because of the more immediate critical care needed for the baby. However, because the birth facility filled out the card and sent it in, the newborn screening laboratory was prompted to call the hospital, who reached out to the healthcare providers to complete the process. It is critically important to complete a newborn screening card on every baby, even if blood will not be collected. Stating the reason for not collecting the blood in the blood not screened field is imperative because it allows for the appropriate follow-up action to occur. Together, we need to ensure that every baby is afforded the opportunity to be screened. The blood not screened box provides an opportunity for the birth facility or midwife to offer information on why the baby was not screened. Remember to complete as much information on the card as possible and then check the appropriate reason. For parents who decline screening for their baby, check the declined box. This card provides the documentation that the screen was offered to the parents. For babies that expire prior to collection, check the deceased box. For babies that will be transferred to another hospital, check the box Transferred and provide the name of the receiving facility. Do not send the card with the baby to the new facility. Instead, be sure that the transfer facility is provided with the necessary information, such as birth weight, to complete the newborn screen. Once completed, send the blood not screened cards to the newborn screening laboratory in the same timely manner as a routine screen. The newborn screening laboratory will replace cards submitted for not screened notification free of charge on a monthly basis. As a side note, do not write in the blood not screened box if you want the blood on the card to be tested. At times, we have received cards with blood collected and the box declined checked. On this slide, you can review the details provided for each field. When you are ready to begin the next section, click on the Next button.
In Section 7, we provide helpful reminders for completing the yellow and pink sections of the newborn screening card. These fields are used for pulse oximetry screening results and hearing screening results. Parents may elect to perform one or all three screens for their newborn. This data is transferred to the Department of Health, who follows up on any abnormal results. Here are some helpful reminders for completing the pulse ox fields. Always order the date screened with 2 digits for the month, the day, and then the year, and write the time in military time. For the results, only check one box: pass, fail, or not screened. If pulse ox screening will not be performed, check the box for the appropriate reason. If other is selected, write in the reason why pulse ox screening was not performed. If pulse ox screening will be performed, but is not complete when the blood specimen is ready for shipment, photocopy the newborn screening card and ship the blood specimen. When the pulse ox screening is complete, record the results on the photocopy and then send the photocopy to the laboratory with the next shipment. As a reminder, when photocopying the card, protect the blood specimen by placing the flap of the tan cover over the spots. Here are some helpful reminders when completing the hearing screening fields. Write the date screened with 2 digits for the month, the day, and then the year. For evaluation of the right ear, check pass if the hearing results are normal. Check refer if hearing results are abnormal. For evaluation of the left ear, check pass if the hearing results are normal. Check refer if hearing results are abnormal. Circle hearing screen method. Circle ABR for the auditory brainstem response method, also abbreviated as AABRR. Circle OAE for the otoacoustic emissions method, also abbreviated as TEOAE or DPOAE. Circle both if each method is used. If the hearing screening will not be performed, check the box for the appropriate reason. If other is selected, write in the reason why hearing screening was not performed. If hearing screening will be performed, but is not complete when the blood specimen is ready for shipment, ship the card to the laboratory. When hearing screen is complete, enter results into WeTrack. Every site should have a WeTrack coordinator. Never hold the card for hearing results. On this slide, you can review the details provided for each field. When you're ready to begin the next section, click on the Next button.
In this last section of the webinar, we will discuss corrections, how to best make corrections to the card both before and after submission. If a single error is made when completing card information within a given field, it can be corrected by drawing a line through the error and then writing the correct information next to or above it. Never write over the information in error as an attempt to correct it because oftentimes this makes the fields illegible. Also, never use whiteout on the card to correct an error. In this example, the time of specimen collection was incorrectly written as 10:17. It was corrected by placing a line through the error and writing the correct time, 11:17, above the line. For larger errors affecting multiple fields, it is best to simply use a new card. Write the word credit across the card with errors and then complete a new card for specimen collection. To ensure that hearing and pulse ox screening results are recorded, please submit data on a valid card, not the card with errors for which you are requesting credit. Remember to send both cards, the card for credit and the specimen card, in the same envelope with the courier to the laboratory. Never delay sending cards, even ones needing credit. The Wisconsin State Laboratory of Hygiene Newborn Screening will provide replacement cards for properly returned requests for credit. Of course, the best way to deal with corrections is to avoid needing them in the first place by ensuring that every card is complete, legible, and accurate before it is sent to the laboratory. However, at times, errors are noticed after submission. There are two opportunities for you to identify errors after submission. The first way is by reviewing the Confirmation of Received Specimens report. After specimens have been received and the information on the card has been entered into the laboratory system, you will receive a Confirmation of Received Specimens report. This daily report contains the patient's name, ID number, date and time of birth, and date and time of specimen collection. The report serves several functions. You can use this report to ensure that the information provided on the card matches the patient record. Additionally, you can check that we have received all of the specimens that you have sent. To make corrections on the Confirmation of Received Specimens report, place a line through the incorrect information and provide the correct information next to or above it. If fields are missing information, you can provide it at this time. Write the name and phone number of the person submitting the edits on the report and fax it back to the newborn screening laboratory using the number provided. Review of this report and appropriate action steps will reduce the need for amended reports and phone calls for information verification. The last opportunity to identify errors is upon receipt of the baby's newborn screen report. On the report that you received, circle the incorrect information. Write the correct information next to or above information in error. Provide the full name of the person requesting the correction, and provide the phone number where you can be reached for any necessary clarifications. Once the report is edited, fax it back to the newborn screening laboratory using the number present at the top of the report. At times, hospitals have used a screenshot from the patient record to provide corrections. This is acceptable as long as the image contains the baby's birth date and mother's name for ease of identification, along with a notation of the correction needed. Please also ensure that the screenshot is legible.
This concludes the webinar on how to complete the requested information on the newborn screening card. We hope you found this webinar informative and that you have identified ways that you can ensure that the newborn screening card is complete, accurate, and legible before it is sent to the newborn screening laboratory for testing. Be sure to visit our newborn screening website at www.slh.wisc.edu/newborn to obtain educational material and helpful guides presented in this webinar. You can also email us at nbsqualityreports or call us at 608-262-6547 with any questions you may have. Additionally, please update the contact information for your newborn screening site liaison, as well as other key providers. Following the webinar, you can test your knowledge by playing a short game to see if you can identify errors on a newborn screening card. Thank you again for helping Wisconsin babies get started on the right foot. There are 6 errors on this card. Can you identify them? Please review the card. The errors will be revealed in 30 seconds. Error number 1. Is the name Baby Boy Drews or Greg Smith? Both were provided. Error number 2. The multiple birth field is written in error. Error number 3. The birth date is after the collection date. Error number 4. Does the baby weigh 3.1 kilograms or 3 pounds and 1 ounce? Error number 5. The birth facility is missing. And finally, error number 6. Declined has been checked in the blood not screened field, but blood has been collected. Did you identify all the errors? We hope so. Thank you again for your time and attention to the process of completing requested information on the newborn screening cards.